In this video, I'm gonna do a cephalocaudal assessment from head to toe. And first, I'm gonna do a general physical assessment to my patient. And in this manner, I'm starting to see if there is any signs of cyanosis or any paleness to the patient. Now, I'm gonna introduce myself to the patient. I'm Andrea Silva, your student personal support worker for today. And may I ask your name and may I ask what you're here for?
I'm John and I'm here for physical assessment.
Okay, thank you. And as I'm asking him that, I'm also checking for his level of consciousness. And now what I'm gonna do is I'm gonna check his vital signs. And the first off that I'm gonna do is to check his blood pressure. And his the normal blood pressure rate is 120/80. The next is I'm gonna do is check for his pulse rate. Can I borrow your hand, please, sir? Thank you. So I'm gonna check his radial pulse. As I'm checking it, I'm checking for the rate, the rhythm, and the strength of the pulse. And the normal, thank you. Then the normal pulse rate is 60 to 100. Now I'm gonna check the respiration, the patient's respiration. And as I'm checking it, I'm checking for if he's having a difficulty in breathing. I'm also checking for the rate and the rhythm. And the normal respiration rate is 12 to 20. And I'm also gonna check for his temperature. And the normal temperature rate is 36 to 38 degrees Celsius. And the oxygen saturation, one vital signs too as well, is the normal, the rate is 95 to 100. And now, I'm gonna ask the patient to please stand up. Stand up. Please stand up, sir. Thank you. Because I'm gonna check for his height and weight. As I'm checking it, I'm also checking the way he moves, his gait, and I'm also gonna check if there is any difficulty in mobility. Thank you. And now I'm gonna ask if the patient is feeling any pain. Do you feel any pain, sir?
No, I'm good.
And do you have any allergies, like in medication, food?
No, I don't have any allergies.
How about latex?
No?
Okay, that's good. Do you have any history of hospitalization?
No, I've never been into hospital.
Okay, that's good. Thank you. And now, as I'm done with the general physical assessment, I'm gonna go with the head assessment. And then before I proceed, I'm gonna sanitize my hand with a Purell or alcohol. And then I'm gonna wear my gloves. I'm gonna start off with the head. Can I get your head? Thank you. I'm gonna check the scalp if there is any dryness, any dandruff, lice, lesions, skin breakdown, or any signs of alopecia or baldness. Okay, everything is normal. And after that, I'm gonna ask the patient to remove his glasses. Can you remove your glasses for me, please? Thank you. I'm gonna start off with the eye. So I'm gonna check if there is any redness around the eye. I'm also gonna check for the color, any discharge, and redness around the eye, lesions, stuff. And I'm also gonna check for perla, which stands for the pupils are equal, round, reactive to light, and accommodations. On the other side. Okay. And the diameter is 5 millimeters. I'm gonna check the if there is any asymmetry on the face. I'm also checking if there is any skin breakdown, lesions, redness, scars, or acne. And now, I'm gonna check his nose, the patient's nose. I'm gonna check if there is any redness around the nose, any discharge, and I'm now also gonna check for any nasal flaring or patency of the. And as if I'm gonna check the patency. I'm gonna ask the patient to hold patency of the narines, and I'm gonna check if there is an air passing through his nose. Another side. Thank you. And now I'm gonna check the mouth, but first I'm gonna check the lips. So I'm gonna check if there's any sore, redness, or cracked on the lips. And can you please open your mouth? Thank you. I'm also gonna check to call if there's any discoloration, any cavities, any dental caries, any lesions. Because usually the normal color of the gum should be pinkish. And now I'm gonna go ahead with the ears. I'm gonna check if there is any lesions behind the ears, any screen breakdown, redness. I'm also gonna check if there is any asymmetry with the ears, and I'm also gonna check the outer ear, the inner, on both sides. And now I'm gonna go to the neck. I'm gonna first check the carotid pulse, which is located here. I'm gonna check both sides. Okay. I'm gonna palpate if there is any lump or goiter, and also check for the asymmetry. Now we're done with the neck. I'm gonna proceed with the chest. And now in the chest, I'm gonna check for temperature. I'm gonna check for the temperature. If there is any discoloration, if there is any lesions from breakdowns or sores, or even abnormal moles. I'm also gonna palpate if there is any soft or hard lumps. And now I'm gonna auscultate the patient. I'm gonna auscultate the patient in the left mid clavicular fifth intercostal space. As I'm checking it, I'm checking for the rate, rhythm, and the quality of the heartbeat. And now that I'm done with the chest, I'm gonna proceed to the back. Can you please lean forward, move forward? Thank you. As I'm checking the back, I'm checking for any lesions, breakdowns, and abnormal moles. I'm also checking for the temperature or any discoloration. And now I'm gonna check for the symmetry chest expansion. And in this procedure, I'm gonna ask the patient to do deep breath. Inhale, please. Exhale, inhale. Exhale. Inhale. Exhale. Thank you. And now I'm gonna proceed to auscultate the back as well. And I'm gonna check for any adventitious sound, any crackles, any wheezing sound. Inhale, exhale, inhale, exhale. Thank you. Can you please sit back again? Thank you. Feeling good?
Yeah.
And now I'm gonna proceed to the upper extremities. So first, can you borrow your hand, please? I'm gonna do cap refill. So I do cap refill just to check the circulation of the patient. I'm also gonna check for skin turgor. just to check if the patient is dehydrated or not. Okay. And now I'm gonna check his radial pulse on both sides, just to see the rate and rhythm and the strength, or if there is any irregularities. Capital, skin turgor, and region. Thank you. And I'm also gonna check for the range of motion. Can you move your hand?
Yeah. Yep.
Okay, that's good. And now, as I am done with the upper extremities, chest, the back, and the head, I'm now gonna ask the patient to assist the patient in bed, just to have an abdomen, genital, and lower extremities assessment. But before that, I'm gonna do the strength muscle test. Can you squeeze my hand?
Okay.
Thank you. It's important to know also the dominant hand of the patient, because usually the dominant hand is much stronger than the non-dominant hand. Can you now proceed to the bed? Thank you. So, just make sure that you provide comfortability and privacy to the patient. So I'm gonna do the abdominal assessment. So as I do the abdominal assessment. I'm checking for any lesions, breakdowns, or any redness or abnormal moles on the abdomen. So first I'm gonna inspect for the temperature, color, discoloration, lumps, and now I'm gonna auscultate the abdomen. So when you auscultate, you start in the lower right quadrant. And in the upper right quadrant, in the upper left quadrant, and the lower left quadrant. In here, you're trying to hear the bowel sounds in the abdomen, and when you don't hear any bowel sounds in the abdomen, make sure that you're doing the auscultation for 5 minutes until you hear a sound. So after that, I'm gonna palpate the abdomen slowly, just to feel if there is any hard or soft lumps. There you go. Okay. I'm also gonna check if there is any discharge in the umbilicus area. Don't forget to provide privacy to the patient. And now I am gonna do the genital assessment. So as I'm checking the genital area, I'm checking for any skin lesions, breakdowns, redness. I'm also checking for the odor and also the discharge, and I'm making sure that I'm gonna ask the patient if he's having a testicular test every month. So are you having testicular test every month?
Yes, I'm doing it.
Yes. And it's important to take note of that to the patient, because testicular test prevents testicular cancer and prevents it. And I'm also gonna check the anus if there is any hemorrhoids, and ask the patient about his bowel movements. So, how is your bowel movements? Is it normal?
Yes, yes, I do it a lot, like early in the morning.
Oh, that's good.
Yeah.
So you don't feel any pain when you're
No,
having
no,
bowel
I'm
movements?
fine. Yeah.
And when you void, how about when you void? Do you feel any burning sensation?
No, no, it's fine. Yeah.
That's good. So after that, I'm gonna do the. So make sure that you're covering any private area. And now I'm gonna do the lower extremities. So I'm gonna check if the other limb is symmetrical to the other. And I'm gonna make sure if I'm gonna check if the knees are distorted or there's any discoloration. And I'm gonna check if there is any sores, lesions, and skin breakdown to the legs. And I'm also gonna check if there's any bleeding edema. And at this point, I'm gonna check the dorsal pulse on both sides. I'm also gonna do a cap refill just to check the circulation. And I'm also gonna check skin turgor for to know if the patient is dehydrated or not. And now, what I'm gonna do, I'm gonna do the strength. See? There. Thank you. And after you do the assessment, make sure that you document everything everything that is abnormal to the patient, and take note if you see any pressure sores at the back, any breakdowns, and report. Also document if you see any abnormal moles or anything that is out of the norm. And before you leave the patient, make sure to keep him safe by putting the rails up, the brakes on. The call bell is also should be in place. And that's it. Thank you.